Hello and welcome back to Authentically Shawna. Today I am joined by Brooke McKeever, who self proclaims herself as obsessed with red light therapy. She has been using red light therapy and talking about red light therapy for 18 years. She is a red light therapy expert. She does sales, teaching, rentals, trainings. She's a business coach and a red light and also other colors of light practitioner. And I am excited to have her join us on today's episode. Welcome, Brooke.
Thank you so much for having me, Shauna. I'm excited to be here.
We're going to talk about light because it's in the zeitgeist at the moment, which is awesome. But I think a lot of people don't know what it actually does and what to do and where to get it. And I think there's a lot of misunderstandings. And so the goal is to help you all who are listening understand the power of red light and when to use it and why to use it.
Let's do it. I love a deep dive in red light.
Me too. So tell us, how did you get to red light? What brought you to red light?
So I was actually in early 2000, believe it or not. I was a client of the inventor of the system I use now, and I had gotten an elbow to my under eye. I played basketball with guys in intramurals and got an elbow and it split open my under eye. And that was the first time I was ever exposed because I was broke, a college kid. My family was in another state. And I was like, all right, not going to the hospital to get stitches. That's not in my budget. And so my trainer was like, okay, this machine will help this heal. And sure enough, it healed without stitches. And I was like, put it in the back of my mind and then continued kind of on my path. So that was my very first introduction. And then a little later, after graduating and then going through a car accident, that's kind of, and going through a year and a half of rehabilitation. After that, I was reintroduced. And I was like, wait a second, this is what I've been missing. So it was just on a different level.
Amazing. So you've been doing this for a long time because most of us, at least myself, I've heard about red light maybe in the past 5 years. So it's really started to shift. What have you seen in this shift from when you first heard about it till now?
Oh, yes, it's a ginormous shift from before I was a snake oil salesman and off my rocker, and what do you think you're doing? And that's from everybody, family, friends, strangers, it was like the pursuit of happiness with like Will Smith carrying a backpack around. That was me with my light. They're like, oh, it was like an ambulance chaser. I'd see people injured in an elevator. I'm like, ooh, I got something for you. Like it was like really creepy then and no one believed it, and it was very hard to get clients. In fact, like, it was some of the worst times in my life because it was just I had such conviction about it, but it wasn't believed, so it was like me against the world, it felt like. Now, fast forward, I mean, I think like you said, 5 years ago is when it really started picking up. Every year in January, it seems to be better and better, and, like, I remember last year or actually the beginning of this year, I even have doctors referring patients to me now, and
Mhm.
last year I have that kinda started, but this year it's like they're recommending them going, not just like, "Maybe think about light therapy," but now they're like, "Hey, go to ultra red," because their patients are starting to, show them the results. And so it's a nice place to be, but before it was about trying to convince people that it would work. Now it's not, people are more convinced that light is acceptable and it is a thing, and most people have heard about it. But now it's about discerning differences between devices. It's not about bait and switch. Here's the research, here's our light, completely different. Like it's about finding the light with the research. It's about finding the effective because you can still see red light and be exposed to it, but you may not have the optimal equipment or
A
have the
therapeutic
best
dose.
the best dose.
Yeah.
And you might have a bad feeling if you just try it once and you're like, "Oh, that did nothing for me." And so it's really about the information time right now. And I think that's where we up from disbelief before in the 10 years before to now the information and kind of getting things settled with what's going to be good for the future and what's just was here for passing an introduction.
What is red light therapy?
Red light therapy is called that because the most popular color or wavelength is red. It's the most visible thing that we see. We also use a combination of near infrared, which is beyond the visible spectrum. So pictures don't look as bright when you see pads or panels with near infrared light because you can't physically see it.
Mm.
But red, near infrared, green, blue, and violet. And those are wavelengths of light that are absorbed in the chromophores, cytochrome C oxidase of the mitochondria. And when it's absorbed in the mitochondria, it stimulates a cellular energy reaction. So it's a photochemical reaction that provides ATP. So the ATP is like the energy that your body uses. That's cellular energy. So basically, fast tracking red light therapy is giving your body cellular energy to optimize itself. And when your cells are optimized, then theoretically your body is optimized. So that's kind of like the long condensed version. Red light can be continuous wave or it can be pulsed. Think of continuous wave like power lines or EMF signals. It's just constantly on. It's one frequency, it's just on. There's a difference now, getting a little into the nitty-gritty, because pulsed light therapy resonates more with our natural frequencies in our body, in our tissues. Everything's a vibration here on Earth. The Earth even has a vibration. So that tends to resonate a little bit more. And when you're using the pulse to drive in the light, then you can really get specific. So, all in all, it's used to increase cellular energy, increase ATP, reduce or release nitric oxide. And the results from red light therapy and the infrared light therapy are that it reduces inflammation, reduces pain, increases circulation, and increases the speed of tissue recovery and repair. So that's kind of the nuts and bolts and the basics of it, but it can go a lot deeper.
Which is what happened for you, right? You saw your tissue repair itself without needing any outside intervention. By giving yourself red light, your body used that energy to then heal itself.
Yeah, it's pretty amazing because I didn't think with the original skin injury that I had, that's pretty basic for me. It's like, okay, that's surface, that's skin. I see how that repairs. Originally, when I hurt myself with my neck injury, I didn't think that this light therapy would help. It took me a year and a half and being told that I had to have neck surgery,
Mhm.
cervical spine, and metal to replace three of my vertebrae and that I would never feel my right arm again. And I had a stick shift and I couldn't drive because I couldn't use my right arm. And so I was like, wait, before I do this surgery, let me just try one more thing. And it was that voice in the back of my head that was like, do this, do this. Like, you need to try something before getting spinal surgery. And I'm so glad I did because ultimately what changed the course of my life.
Absolutely.
I mean, if I would have had neck surgery 18 years ago, I would have probably had at least one more surgery after that, at least. And I would probably have 2 to 3 more in my future. And those are major. So I'm just forever grateful for listening to that little voice in my gut and the nerdy scientist in me that's like, hey, you are your best experiment.
You are. I will self attest to that as well.
Yes, I love it.
Let's talk about the word photobiomodulation. Sometimes when we hear these big words, our brains just go, and that was too big of a word. Shut it down, shut it down. So let's talk about that because I think it's so important if you're consuming information to know what these big words mean.
Totally, and I agree. When I do say photobiomodulation, I lose like 80% of people. It just the screen goes blank. So that's why most people will see it or advertise it or describe it as red light therapy because that's what you visibly see. So photobiomodulation, photo is for photons of light, bio meaning it works on anything living. It won't work on a glass table or a piece of paper, but it will absolutely work on plant, animal, human, and modulation because it has an effect or a change on something. So, photobiomodulation means you're using light on something living to create a tangible change. So, that's the nuts and bolts. That's the scientific term. And the reason that that actually even came about, and it was only about maybe at this point 10 years because time flies, but maybe like 8 years ago, there's a Dr. Ann Liebert, and she wrote a paper on photobiomics. And I believe in there is when she also coined the term photobiomodulation. If not, shout out to Anne anyways, because her paper is awesome. And it talks about photobiomodulation of the microbiome. However, that the term photobiomodulation, which we can just refer to as PBM for now. So if you see PBM, that's much easier to say. But that was coined because a lot of the research initially was on LLLT, which is low level laser therapy. Well, now you have low level light therapy, and you can see the problem. They're identical acronyms, and people were, I mean, even us in the very beginning, before we had actual studies, we were kind of crossing where if it was effective with a laser, then we think it would be effective with the light just by knowing the science. But now it was like, okay, the research was getting, there was getting more and more with light rather than lasers because the light we use is scattered. A laser is a single collimated point, columnated. So if you have all that energy into a laser, that's a lot more energy. That lasers can do great things, but they can also, there's a risk factor. They can be invasive, they can be damaging. So you have to be very, very precise. And the doctors and everything that use them are great, but you have to be very precise. With the light, it's scattered light. It's an energy that's spread out over whole organs or whole tissues or joints in the body rather than in a specific area. So that's where it kind of came about, was the need for the scientific evidence to have to decipher if it's light or if it's laser. So
I love how these things happen. It's so interesting to
yeah,
me.
it is. It's because it's like, and in the beginning there was maybe 1,000 papers, and now there's probably 500,000 on light therapy. And now they're using photobiomodulation. But if you look at the whatever the date was, maybe before 2015, it did not even exist. It was all LLLT.
So if you want to do your research on this, use the word photobiomodulation in your research.
Yeah, or even low level light therapy,
Okay.
that has been low level LED. So I would use just a combination.
Okay.
But all the recent stuff is all going to be photobiomodulation.
Amazing. So if people want to do their own research, that's the way to go.
Yeah,
So if anyone
absolutely.
is a researcher out there now, you know the secret words to look for.
You got it, girl.
Okay, let's talk about what red light helps with in a couple different categories. Because I think a lot of times there's two big categories that we're looking at in life. Is something chronic or is it acute? So let's talk about how red light impacts chronic issues. What are some chronic issues that are helped with red light?
Sure. We have things like chronic pain, like arthritis, autoimmune diseases, neuropathy, things like that, that are more chronic situations. With those, it's excellent. It's all about reaching the point of balance, or I like to say, they use another big word, homeostasis.
Seventh grade science. Here we go.
Yeah, I love that. It just makes me feel like, it makes me feel balanced just saying it. I'm like, I got homeostasis going on. So that's where things are happy. You've got a balanced pH, your systems are working together, the inflammation is down. Now we want to reach that goal as fast as possible when we're doing sessions. So for chronic issues, it's going to take longer. I like to say for every year that somebody's had pain or gut dysbiosis or something's been inflamed and off, so to speak, I need 1 month. Now, I have people that have 18 years of neuropathy and they're just coming to me, and I'm like, okay, you've got to give me, I say 18 months, but usually I can do it in about a third of that time. That's just to get you like, hey, you've waited 18 years, give yourself a little bit of grace and patience to let me get you back recalibrated. Now, it's not going to take 18 months to do for neuropathy, but it gives perspective. It's been a long time. It takes a long time to unwind it.
Absolutely.
And so that's a little different. Same as gut dysbiosis. Like if something's been off for a while, there's other things at play. There's
100%.
other tissues that are affected. The fascia, there might be biofilm, there might be, if it, let's say if we're just talking about gut dysbiosis, well, now you've got depression and anxiety as well because of the gut brain connection. So now we're not only, now that is also affecting your brain because now you're anxious. And so that's affecting your healing, and it's bi-directional. So now we've got two problems that are compounded, which we can help both, but it might take us a little longer. So I'd like to, turn light therapy instead of a last ditch effort, before people give up on getting better and they've gone to doctors and they've taken prescription medicine for months or a year, and this hasn't changed and they're just really at their wits' end and then they crawl in. I'd love to be preventative. Hey, let's do this once a month. Let's do this like once a year. Do your gut, do your brain, remind it, do our lungs, do your immune system. Like every fall season and winter season, the kids, let's have all the kids get an immune boost before they go to school. So we've been saying that for more than a decade about being preventative, but I think it really, now that light is accepted I think eventually, maybe in another 10 years, we'll get we'll get onto the prevention side of things.
I love talking about prevention. So let's talk about like maybe different decades and what would be a good thing to do in different decades of your life for prevention. So we'll talk about elementary school. So you just mentioned getting their guts and their immune systems healthy because they're going to be in a room again with a lot of
Germs.
other humans.
I hear it all the time. I have teachers that are my clients and parents. They bring their kids in when they're sick. We have an excellent
Absolutely.
program for germs, cold, flu, viruses, all of that because as you know, kids are going to rub their hands up their face and touch everything else. So giving them a boost once a season, maybe 4 times a year.
Brilliant.
That's gonna be great for them. Kids, when they get a little bit older, like teenagers or preteen, anxiety. Getting them prepped for the school year with anxiety. I'm seeing that more and more each year. And my 8 to 12-year-olds, they love this. They're still in that age where they're just like, they're still kids, and they still want their parents, but they're also in this growth phase and they want to be like cool when they're teenagers and they want to be socially liked, but they're just like kind of in this anxious stage. And so I really like, and they resonate deeply with the light at this point. Like whenever I have I guess young teens or preteens doing this light, like they actually ask their parents to come back. And so doing
Mm.
that, I think to kind of give them a brain balance while their hormones are changing. Imagine you're just doing the brain and that's affecting the pituitary and pineal so that it's really able to balance their hormones as they're changing. So I think that one's important, but also any growth issues like growth plate pain. There's a lot of kids like a lot of the
Growing
guys,
pains.
girls,
Yeah,
guys and girls like kids in sports is when I see it most is when they
absolutely.
have growing pains. So doing those joints and also kids that are active, being able to help and support their injuries when they're working out or when they're playing sports and when they're injured because kids are healing much faster than we are. And
Absolutely.
so adding in a little light, they don't need as many sessions. So doing that as well. And then I would say as you get older, teenagers, mood adjustment. It's also hormones. Hormones are huge at play. So anything you can do to support hormones as the girls are getting their periods, being able to help with endometriosis, PCOS, fluctuating periods and hormones as things are just starting. I think that I mean, if I had this light that age, I think I would have been a much better teenager. And then helping too with mood, stress, anxiety, and then any physical ailments, but also keeping their immune system strong.
Because they're still in school. They're still in rooms
They're
with lots of
still
people.
in with lots of people.
Yep.
And then as you go into college age, it's really just you're kind of invincible in college, so we'll skip that group. But, maybe the same sort of stuff like brain immune. I think a lot of college dorms, sorry to say this, but are filled with mold. So I
Oh,
think all these kids
yeah.
need a good detox, especially around Christmas and doing before, just strengthen their immune systems. They can usually fight it, but if they're already compromised, that's when we really see it. And then you get into like, okay, childbearing age, if it's early, if it's in your late 20s or 30s or whatever it is for people, helping with fertility. We're a society now which are your hormones, especially women, are being affected earlier and earlier. Men with the sperm count too. I think this is kind of an endemic problem that's happening early and earlier. So how we support that is through the brain and through the endocrine system. So pituitary, pineal, everything I start at the top and go down. And we do everything: adrenals, pancreas, thymus, thyroid. And literally with our pads, you can cover most of these areas with just one or two of them. And then once you get, childbearing and then, your parents, so starting to support your kids, but also doing aging parents, like anybody, I mean, 50, 60, 70, 80. There's all different things. I hear that everything falls apart when you're 65 magically. So at least that's what I hear in my office all the time. So supporting people before that I think is impactful. Doing if your genetics, or if your parents are have Alzheimer's or one of your parents, it's familial with your genes, I would start supporting those things. My grandma had Parkinson's, and so I do my brain and I cut out gluten because for me it's metabolized in my brain. So little things that in your 40s, maybe late 30s, 40s, 50s, you're starting to find out about your own health, starting to be proactive on those. Don't
Yes.
wait for it to be a problem.
Don't
Don't wait for it to be a disease. You get one symptom or sign, just start doing light, let your body get balanced. Don't necessarily have to rush off to the doctor and find out what's going on, but if you feel something, treat yourself. treat your cells and get back to find that harmony, that balance, like a conductor playing a symphony. You can have a violin off or the drums too loud. But when you have light as a conductor of the symphony of your cells, you just need a little bit. It's like going out in the sun. That makes a huge difference for the vitamin D, but we are light beings. So as long as you have a little bit of light, it can really tune the whole chorus.
Let's talk about other types of issues which are acute, more like your eye. What are you seeing people for? What are people coming in for acute issues in your office?
I'm glad you said eye because one of the most fascinating things for us that I think is life changing for people is macular degeneration.
Mm,
That is a difficult thing to treat with standard Western medicine. They usually do injections into the eyeball. So I don't know about you, but I can just visualize a needle going to my eye.
no,
Not
thank
only
you.
that, it's very expensive and oftentimes it doesn't work. I've had a handful of probably 5 clients that this has absolutely turned their life around. My most
Mm,
recent one was a lady, she's 63 years old, I believe, and she was told last Christmas that she was going blind and she has macular degeneration. And of course, that ruined her Christmas. She came to me once before the new year, and she came to me 2 more times after that, and she went back to the eye doctor, and he said, "You don't have macular degeneration anymore." So then I saw her a year later, or almost a year now, it hasn't been a full year, maybe it was like 7 or 8 months. But she basically was like, "My eyes are great, let's do this," and so we just did a refresher, let's keep them good. So that's an acute injury, like wounds, any type of wounds, skin tear, contusion, things like that, injuries. So ankle sprain, ACL tear, things like that post-op.
okay,
This is really good for post-op. We actually recommend pre-op as well. So we've
brilliant.
had surgeons that we work with where we worked with their patients where we've done pre-op doing even one session. You get the tissues viable, you take the inflammation down, it makes for a better surgery. So for the surgeon, it makes for a better surgery because you
Makes
have
their life easier.
viable tissues, and then you recover better. And then people like yourselves, the physical therapists that come in, they actually love it when we're doing, I mean, that's the feedback that we get. When we're doing light on their patients, they see a difference. And if they don't know that their patient, our client is doing light, we always encourage our client, like, say something. Sometimes they're timid, like, oh, I don't want to mess with the program. Like, say something so they know why you're doing so good or
Right.
why you're, I mean, the last guy that came in, he overheard one of our clients who was renting a machine after her ACL tear. She did surgery, but before she did surgery, she was walking 5 miles a day before the surgery because she was doing light. She was out of her brace. Her goal was to ski again. So she's in her PT office. This guy overhears her talking because she's so far ahead of schedule after her surgery that they're like, "What have you been doing?" She's like, "Oh, I rented a light machine." So he calls us to rent, and we're like, "Sorry, we got a little wait list, but you can come in for sessions." So he did pre and he did post-op, and he was 4 weeks ahead of schedule. And so that's at his PT, and they're like, "I don't even understand. It's unbelievable." And that's because everything is just working better. And we actually have a published study with our device on post-op knee replacement surgery. So we have, it's not a knee replacement, but we treat it similarly, and we're able to get excellent results.
That's amazing.
And so this study was done with our device in a hospital in Taiwan. And so it's peer reviewed. So I can also link that and share it with you.
Let's talk about dosage, about how much is enough versus too little.
When we first started, the classic machine that we had was all 20-minute programs. And I mean, I could barely convince people to do 20 to 20 minutes. Now, our most popular one, actually, it's kind of shifting. Our most popular is between the 40 minutes and the hour sessions. The newest system that we have just runs hour sessions as well. So they're designated for that. You can stop anywhere in there, but it kind of stacks different frequencies, so they're for specific indications. If I'm, let's just say, organ distress, that's a whole hour treatment. Like, yeah, you could do 20, 40, 20, 30, 40 minutes of it, but you should absolutely do the hour because it takes you through this journey, takes you through a journey of certain frequencies. Like, for example, organ distress or lung distress, first it's going to relax the lungs. So you want to do a high frequency to calm the coughing down and the distress. If you're like,
Mm,
can't breathe and everything, you got to calm it down. If I do something to maybe kill the pathogen or help with the inflammation, you're not going to still be able to breathe.
right,
It's not going to calm you down.
right.
So I need to take you on a journey. So we need to calm things down first. similar to inflammation. Similarly, in pain, I have a program that will address the chronic pain. It's for joint degeneration or chronic pain versus acute pain, like we were talking. Well, they're a little bit different. They
Absolutely.
vary by a little bit different frequencies. Similarly, like I also, if it's something is in high pain, like 10 out of 10, if I don't address the pain and I just address the inflammation, the person leaving isn't necessarily going to feel as good as if I address the pain and the inflammation. And the reason is because once we start, there's the temporary relief and then there's also the lasting relief. Because you do the session and it's almost like an immediate relief with the highest frequency. It's called relaxation. It's close to 10,000 hertz, which is the same frequency that's like in a spinal pain stimulator device. It's a known frequency for pain relief. And so I can do that and I can get a 10 out of 10 in pain down to a 6 or down to a 4 in just one session. But building off of that, 6 to 8 hours after we do the session, that's when the photochemical benefits start happening. 6 hours all the way through 48 hours. So when you leave here, you're not done. You go to sleep. That's when the magic is happening because we're healing when we're asleep. So now all that extra energy is in the tissues that we're treating, but it's not contained. There's not a wall around the knee. So it's able, all those photons of energy are able to go everywhere in the body. It's used wherever. Yes, it's concentrated on the area that we put the pads, but it's also going to have a systemic effect, which is going to help everything. It's going to help your lymph system. It's going to help the circulatory system, and it's going to help the peripheral nerves as well. So you're reducing pain. And then so what people feel is the next morning, the morning after, I'm like, "Okay, check the morning after. That's going to be your best thing." They feel even better. And then even the next day it continues working. So it really goes on this, really like taking you on a journey where you leave here, you feel better, but it's going to keep getting better. And if it's more chronic pain, like we were talking about earlier, that time in between the session and when the pain is, you have the relief and how long you have relief, that changes. If it's more chronic and severe pain, you might only get relief for an hour. You might, and it might not even last through the next day. If it's more acute, it's going to work for like 2 or 3 days.
Right.
And then we hit it again. And then our goal for this chronic pain is to just do a little bit more because we need to get them to that level. We needed more concentrated light for more and longer damage to tissues.
And you watch that progress as people see you for longer and longer time. So you're
Yeah.
able to tolerate more, I'm assuming, just like anything. As you go and as your body again comes into homeostasis, you can get bumped up to other frequencies because your homeostasis level is now at a different place.
You're exactly right. So what we do is we try to start our perfect ideal program is if people come 3 days a week for the first 2 weeks. Then we taper you off because our goal isn't, if we're not doing our job and have you come 3 days a week for an unknown, unlimited amount of time, you're not getting better.
Right.
So we like to show that you're getting better, but listen to the body. So we try 3 days a week the first 2 weeks. And the reason is because if it's lasting 48 hours and we hit it again within that 48 hours, you're not kind of going,
Crashing.
yeah, you're having more of an even like upwards trajectory of healing instead of just very going up and down. And so we try to keep that and maintain it. But people will go 3 days the first week, 3 days the second week, then 2 days the next week, 2 days the following, and then one and one. And that's ideal. Now, if you can only come 2 days the first couple weeks, no problem. We'll do 2 weeks until you feel like you can do one day a week. And then we go down and then we start doing every other week. And then you're like, okay, what's your threshold? Is your threshold 3 weeks before it starts to hurt again? And before your life gets busy and you're like, okay, that's in pain. Like now we don't want to chase it. We just want to get it before it gets to that point. And then
Absolutely.
sometimes, we do recommend for everybody to do maintenance after this. But I can tell you, once you're better, see you later. Most people, they might come and do maintenance like once every 6 months, but usually not unless it's hurting again.
Right.
So it's actually addressing the root cause, the inflammation, the pain, and everything. So it's theoretically healed. I gotta stay away from that word with the medical device,
Absolutely.
but like
Absolutely.
that's what it's doing.
Yeah.
It's your self healing. It's empowering self healing. I'm not healing you. The light's not healing you. You are healing you with the extra energy.
It's the
And
fact
so
that
it's
you
also empowering. It's like in your control. So I like people like really get confident with it. It's like, oh, this is my body. Like I'm just fueling up my body.
You get to let your body do what it does, and you're not mentally trying to heal your tissue. You're just letting your body do what it does.
Just automatic.
Let's talk about uh, brain function because I know that so many people as they age tend to have cognitive decline. And it's happened in my family. You said it's happened in your family. And so let's talk about how we can prevent and help with our brains because it's such an important piece of our health journey and something that we don't really talk about how to keep ourselves mentally and emotionally and physically well in our
Mhm.
brain.
It is so important. So we'll talk about regular brains and then we'll talk about brain injured brains.
Yeah.
For just normal, everyday, regular brains, regular, that sounds so weird, but non injured brains, we'll say. Preventative care or just daily stuff is stress, anxiety. So it's all about the region of the brain you're treating. For central nervous system and peripheral nervous system and relaxation, we can go brain stem and ears. So with our pad system, we can cover a pretty big area of the brain. So you're either going the back of the brain and the sides, so the temporal region and um and the back of the brain, or you can also go over the top in the corpus callosum and to connect the hemispheres and over the ears. I always include the ears in the brain, or you can go to the front of the brains, frontal to prefrontal cortex and temporal, and that's where mood and cognitive functions
Yeah.
and
Higher order
memory and
thinking.
everything is. The reason I always cover the ears is because just like your eyes are designed to receive light, so are your ears. And if you triangulate into your brain, just like think about where if light was to shine in through your eyes and kind of go down, like from the sun down and in through your ears and through kind of like up in your mouth, like through your soft palate, that's where your pituitary and pineal and hypothalamus are, right back there in your lower brain.
Yeah.
So your eyes and your ears, and kind of your mouth, are directly triangulated right in front of your major endocrine glands that kind of rule everything. And so if you can get into there, then you're going to make a big impact. We've even seen people with like a pituitary cyst that's been gone away with the light. So, just in general, treating those positions, you can treat front brain if you want cognitive improvement, back brain for balance, temporal brain fog right now. I should have done my light, but you could do all kinds of stuff. So that's doing it for preventative care. You can do it for stress, anxiety, or prevent Alzheimer's, prevent dementia, prevent Parkinson's by stimulating these. If you're able to clear out the tau program proteins at night and stimulate that, like, if you're predisposed for Alzheimer, or if you just feel like you're forgetting a lot lately and you don't want it, then why not stimulate it? This is going to help to increase the brain cells in there, but also strengthen them. So it's going to optimize the cells in your brain. We've seen regions and scans where there's like white or gray areas from somebody who had a hypoxic event, and those after doing probably 6 months of light with a home device, those had filled in with healthy brain tissue.
Amazing.
And that was before thought to be impossible. But I've seen it. I've helped this young lady with her condition and to guide her along with this. She's actually had that happen and shared those scans with me.
Amazing.
So that's kind of on the preventative side is just caring for your brain. If you feel a little anxious or you feel a little sad or depressed and you want to try something other than medication, this is a great non-invasive, non-addictive, non-toxic. It doesn't affect your kidneys. It won't have any side effects other than maybe dehydration, which is very controllable. And this is a good natural way to do it. And if you don't have a light therapy studio or a device or anywhere nearby that you can do, go out in the sun. There is the reason light therapy is a thing is because of the light from the sun. The only reason we don't do that much sun is because of the UV rays in the sun. So light is the non-ionizing, non-harmful rays. It's like harnessing all the good stuff in it and none of the bad. But if you don't have access to it, at least get yourself some of the natural light because
So
that
true.
will affect mood. And then on the other side, for the brain injured folks, I myself have had multiple brain injuries, so I this has really resonated with me. I've taken courses on it as well with the Brain Injury Association of America to help me, but also my clients. I have a new device which can measure the EEG without having to shave your head and do a ton of points on it and use the gel or anything. It just measures through the frontal temporal lobes, and it gives you an active view of the 7 points of EEG in your brain. You can also see gamma, theta, alpha, and beta waves, and you can isolate them. So I had somebody in here earlier today who it's his third session. He was hit by a car when he was on a bicycle. He's a cyclist. He was in a coma for over 40 days. He injured his arm as well, but he's just now getting in here, and it's been a couple years for him to be able to even come in. But we've seen some changes. He's been able to sleep now. We're trying to get him into back into his feelings, but things like this, like it's so impactful. Stroke improvement from light therapy. TBI, we have another gal up in Northern California right now. I can't share too much of her story, but she was in a coma. She actually died in the hospital from a lack of oxygen, I believe, for 11 minutes. This is unknown, and this is maybe it's either a year or 2 years now that it's been that she's. I think it's a year that she's been in the hospital. But this case is so fascinating because they declared her dead in the hospital many times. The family had to fight with a court case to keep them from pulling the plug on her. She's been doing light the whole time, and now she just opened her eyes, and she's able when they say lift your leg, she lifts her leg. So that's somebody that it has brain function, and that's somebody that's not brain dead, that's coming back, and she's able to respond. She has her eyes open. She's blinking, she's looking at you. That's not somebody who was ready to get the plug pulled. So things like that, it's just incredible. We've had stroke clients who I have a guy using my device right now. We rented it to him, and his goal was to walk 300 yards to his daughter's house. He's walking 3.5 miles after 1 month of using this device at home. So what we did is we rent one of our medical devices to him. We train him, and this can be all over the United States. We can ship it and do it via webinar. But this person is up in just further away in Southern California, but just a little too far to come here. And he's on his third month. He's now driving his new Porsche that he got, which his goal was barely to walk. So
Right.
he's driving. His physical therapist is making sure he's good, and he's driving with him. And that's impactful for him, his daughter, his wife, his whole life. That he was already just very motivated and recovering quickly, much faster than normal. So he was already 6 months into his stroke, and he was making tremendous waves. This light took him to the completely next level. And his friend, who's our client, who told him about it, is just giddy over it and tells us all the time, that they've been talking and he's much more forthcoming to his friend. I'm like pulling strings. Healthy brains or injured brains, it's good for both. But why wait for a problem?
Let's talk about the brand of light that you use in your clinic. What separates this brand? What made you decide to use this brand in your life?
So I exclusively use Light MD. It's a brand. They're outside of Cupertino. Our headquarters are in Cupertino, and then our manufacturing is GMP, FDA approved. It's in Taiwan. I've been working with them since the very beginning. That was the first device I tried. Dan Shell invented it. Before it was Light MD, it was called A Perfect Light in 2000, APL 2000, because it came right after he designed it right after NASA had come out and published their studies on red light and near infrared light. And he's an electrical engineer. And what set this machine apart from any other device is that it started in 2000 with pulsed frequencies. Back to when I was saying continuous wave versus pulsed frequencies, it's the natural rhythm. We all have a frequency. There's the vibration. If your cells are used to pulses, it's not used to something continuous that's just going to overwhelm it.
Yeah.
And so the pulse allows it these micro breaks. So this machine that was pulsed used frequencies for different tissue types. So each different tissue type that you have, if you can imagine a bone like a club, a nerve like a violin string, and then tendons and ligaments, skin. So all these different tissue types. But I like to do the bone and the nerve versus muscle. They're like you can picture very different tissues and cellular makeups. Well, because they're different, they're also vibrating differently because their cells are different, because their consistency, their cellular makeup is entirely different. They resonate to different frequencies. Well, we use musical octaves, 8 musical octaves that are different frequencies. And now you're tying in the symphony, why PBM is the conductor. You're using frequencies that resonate with different tissue types. So if I'm working on an ACL, I need to do ligament dominant frequencies. If I'm doing something for arthritis and chronic pain, that's going to be a low frequency versus if I'm doing something for nerve, that's going to be high. And I'm talking low like 100 hertz versus high like 10,000, like a big difference. And we go anywhere in between. And so doing that is going to help discern the tissue types. I've been using it's the machine that I'm cool with. It's also the best product that I've ever tried for light. I'm not a light snob anymore because I've actually tried a ton of other devices. I give them a chance because I like to know that what I'm still using is the penultimate, is the best. And I like to understand also what my clients might be using and how that works. And I use it when I'm in pain. So I know what my device and the Light MD does when I'm in pain. I know how it can take down my pain. I know what programs to use. If I use another device when I'm in the same pain and I don't have a similar effect, then I'm like, all right,
Not it.
not it. And it's really, it's not any light is good. Okay. So I'd say just if you're on the fence and you can afford a certain light, do it because you can use a face mask. You can use it on your knee if it's hurting. It's not going to do what our light's going to do. It might not repair it, but it's going to be better than nothing. And I say dipping your toes in the fountain of youth by using maybe a light that is a consumer product, which is maybe a popular consumer product like a face mask or a panel or a wand. That's dipping your toes in the fountain of youth. If you want to take a deep dive, get a real deal medical device, a trusted machine that has decades of research and clinical studies and applications, practitioners using it as well that's trusted. Get something that you have guidance on. That's another thing is all of our systems come with support. And I know the type of support I need. So that's the type of support I provide. I provide one-on-one support. We answer questions, but when you teach a man to fish and they know how to fish, they know how to use their device and be resourceful. So it's like setting them up right. Really going through the science of it, really going through the building blocks of why you need it, where to apply it, what the frequencies are. And then also when people need extra guidance, I have something called the Light Academy so they can learn. And I have people who use other devices and can come to the Light Academy to learn generally about light. But for most of the second and third course for it are for all Light MD owners. And they're all practitioners. In fact, I had my last member was a doctor of physical therapy as well. And she's in Santa Monica. And she had used this device for her own journey with Crohn's. When she was in college, she actually had to drop out of school in the East Coast because her Crohn's was so flared up. So her parents had bought her this device. She ended up going back to school, going back to get her doctor of physical therapy and starting her own business where she's working with physical therapy patients in Santa Monica. Well, now that she took my course, she's like, I'm going to incorporate this light into it because I have it. I use it on myself. But now she's more comfortable with it and she's trained better. So now she knows what to do. So I love seeing her posts all the time and she's incorporating it into her practice already. Light MD, I do sales for them. I sell to doctors, wellness practitioners as well. We have a pet device. So if you're a veterinarian or lover of animals, a rescue organization, this is a way to actually cut down on your vet bills because you have something in house. And then everyday people. You don't have to be a doctor, even though it's a medical device. You do not have to be a doctor to operate the machine for yourself or to have a business out of it.
And let's talk about what are some words or frequencies, or what are some things that if people are first dipping their toes into red light, what are some parameters? Can you give us some parameters for people who are like, maybe I want to get a face mask. Maybe I want to get a little box. What are parameters that you recommend for the novice?
Okay, so the parameters, if somebody wants to purchase a red light device for home use, I like to personally look for devices that are going to touch the skin. Panels are wildly popular.
Yeah.
It makes the room look really bright and red and cool. But let me just tell you, there's a study that shows, and I don't have the name of it, but I can find it and send it to anybody who wants. There's a study that shows if you're more than 1 centimeter away, you're losing 90% of efficacy. Now, those panels have to be 6 inches away. They'll say, all warning, do not sit 6 inches closer than 6 inches. So, right there, 6 inches, think of it in centimeters, you're losing most of the efficacy.
Yeah.
However, what it is doing is it's getting to the skin. Now, even though our skin is designed to refract light, diffuse, absorb, because think about the UV. We don't want to fry our organs just by being outside. So your skin and your dermis is designed to do that, to protect you. But in addition, so if you have red light from a panel, it will hit off of there, it will reflect, it will do that. However, you will get some absorption. And some of that absorption is all you need to get a little bit of circulation. A little bit of circulation goes a long way. So don't be scared don't steer yourself away from getting a panel if you need something. It's better than not having access to red light. It can kind of be like a little intro for you. I like devices personally that will hug the skin and conform to the body because that's going to touch the skin. That's going to get your deeper results. If your goal is just skin, I think any light device will be fine for you. If your goal is deeper tissue penetration and whole organ, I think you need to get something like a medical device because that's what really is going to be penetrating deeper. Like we use for LightMD, ours are medical grade silicone pads, and they have over 1,200 LEDs. That's a lot of LEDs. You want something with more LEDs than less. You also want a certain power density. So you don't want too much power. You want an evenly distributed power through all the LEDs, which LightMD has a patent for. So that's kind of hard to get to. But as much as you can to get those systems, face mask, I would recommend something that's more flexible, silicone, rather than a hard face mask because it's just going to fit the curves better. Something like that. If you prefer, they have like a torch, where you can do meridian points. It's almost like a
Mhm.
flashlight. That's something that some of my clients do for when they're traveling. If they're on a plane, they just use a torch for spot healing, but also for meridians. There's a wonderful lady I can connect people with on Facebook who leads a group on the torches. You can do also like a little wand and you could do a spot treatment, but that's a little bit more arduous. If you have to rub it around and go in a circle on your joint, you're spending it's not really a passive treatment anymore. It becomes
Right.
an active treatment. And people, when they do active treatments at home, tend to kind of trail off because we get lazy. It's like, okay, I just worked all day. I don't need to come home and work some more. Like I know myself too. So I want something just put on, set it and forget it. And then one more thing too, so I talked a little bit about the power density or the radiance, and that should be between 10 and 100 milliwatts per centimeter square. And then more infrared dominant. I don't think, well, actually I heard Andrew Huberman recently talk about how infrared was really the crux and the big thing about light, that when people were getting it all wrong because red light, that's not even the most powerful. And I was like, yay, a big giant voice like Andrew Huberman is now telling the people what they need because all of our programs, except unless they're for facials, they're all infrared dominant because infrared is going to penetrate deeper. It's going to get the organs, the viscera, the bones, past the skull to the brain. That's the real magic is the infrared, but you can't see it. So it's not as exciting as seeing a red room or red on somebody.
That's good to know
Yeah.
because
So
I think a lot of people see a red light and go, I need to be doing the brightest red there is. And so there's good data to support that the color is not necessarily the thing to go for.
yeah, and also too much isn't a good thing either. You've got
Absolutely.
all these new devices that it has 10 things in one. It does sends you down for oxygen, like you're an oxygen chamber, you're light. You've got this going, you've got something blowing. Like that's a lot of stuff going on. You're stacking, like light's really good on its own. But when we first started this, they're like, oh, this feels so good. I want a blanket of it. Well, now they have blankets of it. But is that a good thing? Not necessarily. Our CEO, who's of the device company, who's a microbiologist, a physicist, an electrical engineer, he's like, that's the fastest way to turn you into a California raisin. That's not a good thing. It's
Too much.
flooding. So there is a dose of the light. We have dosed it where it's a maximum of 1 hour per location per day, per body part. Now you'll be way more tired and asleep before you go 12 hours on your body. Like you'd just be exhausted and you might be a little dehydrated. But if you think of it as not overdosing and not underdosing, it's just the right amount because there is an oversaturation rate. Too much energy, you're going to start having negative effects. And there's studies on that too, where it's the dosing has to be in the perfect optical window where it's not too much for the cells and it's not too little. And so we figured that out with 25 years of experience in devices and doing this in clinical applications. It's pretty, after that long, we have seen anecdotally and with studies what the right dose is.
And I think that's probably the thing that is probably hardest to convey when you're not a practitioner to people who are just, how do I get access to this? I have an injury. I'm just going to bathe in red light all day, right? Okay, how do we teach people what a therapeutic dose is so that there's not an overexposure?
And I think that's where a lot of the research is going right now. Some big names in light therapy that are doing exactly this. They're worried, not worried, but they're more scientific in trying to get the exact dose so that can help with more practitioners. And I
Absolutely.
totally understand that. But with different devices and different power densities, different sizes of LEDs, different LEDs, you have different quality LEDs. You have all of these things. You have LEDs that are spec. Like if for our LEDs, it's not just a narrow 6,880. It's like 600 to 699 so that you're getting various wavelengths of the red. It's not just pure red. It's also going into amber and doing this. And it's not pure near infrared. It's also going like into the 800s and maybe a little higher than 880. So you're getting a wider, I don't know how to really describe that, but it's like you're getting a more thorough and encompassing light that your cells don't have to be so specific for. And so it's like you don't want to smother it, you want to cover it, you want to maybe include the whole organ or the whole joint, but you don't need to necessarily have the whole front of the body covered and the whole back of the body. I mean, I saw this one George Foreman type looking of light device and I just freaked out. I was like, "No, it looks suffocating," but it's also like it's too much. It's too much energy. And granted, they do less time for those.
Right.
They like a tanning bed style red light, they'll do 10 minutes. They won't
Right.
sit in there for an hour. So that dosing is probably optimal for their device, which they've figured out, and I totally respect that. But it's just not specific and it's not anywhere like it's not concentrated. If my knee hurts, I'm not going to lay in a tanning bed and think that my knee pain. I want to wrap 360 degrees around my knee and really get into there and then be tissue specific. Is it a tendon? Is it a ligament? Is it both? Is it arthritis? And so it's all about targeting, being more specific and using that information and experience to get our clients better faster. That's the goal. Because who has
Absolutely.
patience to be in pain or injured?
No, thank you. Let's talk about how you're assessing or maybe knowing what to do when someone walks in. So let's say someone walks in and says, I'm constipated, I've had a brain injury, I have a history of heart disease in my family. Where do you start? How are you looking at parameters to know, okay, this is the direction I want to go in. I want to influence their pH, their inflammation. What are your thought processes? And determining what parts to look at first. What's the order of
You're
operations?
getting deep inside my brain now. So originally when I started, I had a kind of a basic intake. Now my intake, it includes an optional intake about first off, why are you here? But the optional is how are you feeling? How's your mental health? Are you anxious? Are you stressed? Are you depressed? Are you excited? How's your sleep? How's your gut? Are you constipated? Are you bloated? Do you want to work on it? Do you want to lose weight? Do you want to gain weight? How are you sleeping? I think I said that. How many hours? Or do you feel rested? How's your heart health? How do you breathe? Do you feel like you breathe? So just kind of really basic things and checking off the box of like checking in with yourself. Like, oh, I haven't thought about that. How's your hormone health? Some people say, I don't know. Some people say, awful, hot flashes, underline, circle, circle. And then I have a map of the body. Show me where there's an issue, you know, show me where you have pain or show me where you're in discomfort if it's nerve. And then I take a moment in my office and I assess. I go over the questions. I say what their primary reason for treatment is, which I always want to address. But since we can treat two areas of the body for each 20-minute session that we do. And most of the time, we have a great first time special. So it's 40 minutes, but it's for the price of 20 and includes a consultation. So really, you can get 2 areas up to 4 areas treated. And so that's like, okay, I can get my elbow, my tennis elbow, I can get my brain, I can get my gut, and let's just throw in my immune system or a thyroid. And so we can tackle a lot of things. Now, I like to spend more time on things than moving everything around 20 minutes. I can do it, but I like to give each area 40 minutes. Or 30 minutes. So if I have an hour, then I can kind of switch. I can do 4 locations and each do half an hour instead of 20. And that will just help us to get to our ultimate goal faster. So really I talk to the client. I see, I also let them tell me what their pain level is. If they're in high pain, that directs me into a certain way. If they're in low pain, how long, if it's chronic or acute injury, how long they've been in pain, how long they've had this dysbiosis, how fast they want to get better. And then we do a treatment plan. And I don't really like to do a treatment plan until I hear how the first session went. The reason is because everybody's different. Somebody could be eating right, not drinking. I mean, perfect Mediterranean blue zone diet. Who knows? Not drinking, 8 hours of sleep a night, no stress, no work, no stress, nothing. That person versus somebody that's working 12 hours a day, has 3 kids, eats whatever's left over from their kids' meal, and not sleeping, maybe a newborn baby. Those people are going to heal very differently. So, what
Right.
I like to do is just assess how they did after the first time. We'll go through a protocol. I have package discounts and everything. I tell them that. But like, let's see what your course of action is based on how fast or how slow you responded to session number one. That to me is like hearing from them the next day, texting them, checking in, or waiting till if they have already booked to come back in and say, okay, now let's assess because it's not just when you leave here, it's the next day and the following day. And that's also a catalyst. Like if somebody's going out, they're like, okay, well, I came in but I'm going out of town for the next 2 weeks. I say, "That's fine because what you've started, the light has started it's a catalyst of the processes in the body. Your body knows what to do with that light. So even though you're going out of town, you're gonna be way better off even doing a session now and starting that process than than waiting, because then you're gonna be out of town and still in pain. So at least get this process started and let your body use those photons of energy to help itself."
And I like the idea that this is a building process, right? Like you're going to see what happens over time. So let's say you're starting with your brain because you're feeling brain fog and stress. And then, great, that resolves. Okay. Oh, but this other thing that I couldn't even process or perceive now comes online because we've healed one part of the body. I'm sure that happens to you all the time, right? Is okay, that people weren't even aware of what this other thing was. It was hidden because your body can only process so many things. Okay, great. We've processed the first 3 things. Okay, now we get to move on and look at other parts of the body as well.
Exactly. I love doing that, and there's even a section on my intake for beauty, and everyone's like, "Yes." But we'll address that because for me, it's like, if you're in pain, you can't work or enjoy your life. If you don't feel beautiful, like, we'll help you along that way, but a lot of times
Absolutely.
if we do the brain or make you feel less inflamed, you feel better, you look better, you're glowing. So
Absolutely.
we have clients that we don't even do their facial and they're looking better, they're looking more energetic, the whites of their eyes are brighter,
Yeah.
their skin is clear. I had a lady today, she's coming to us for thinning skin. She just finished her 12th session. She was doing laser before on like thinning skin spots. She's a runner and she was going to the dermatologist and they were doing laser. No, no shade throwing there. But she was like, I want to try something different. It's getting very expensive
Yeah.
and I have to keep doing it. Well, she went back to her dermatologist after doing the 10, 12 sessions with us, and her dermatologist was freaking out. Was like, "What are you doing? And your arms look so different." And I'm just, putting the light on them. I also do her immune system. I do her spleen, getting the blood moving. She was under the weather the last session, so I did that. So I'm not doing it like the arms for 40 minutes. I'm doing them each for 20 minutes and then moving the pads around. And that's 2 days a week, 6 weeks. And her dermatologist noticed her arms. Like,
Wow.
that's huge. So that's skin repair, that's collagen, that's protein synthesis, that's smoothing things. That's just like giving her quality of life back. How you can show up in the world for what you love, whether it's yourself, whether it's your family, whether it's your friends, how whether it's your job, like how do you feel when you show up for yourself? And then, empowering you and our clients to really take healing into their own hands. It has a confidence booster built in. It's like, I did this. I did this. I helped myself heal with a little bit of light. I think we're, as a society, are kind of trending towards more wellness rather than just medicine and medication and surgeries and invasive things. I think it's just like overwhelming. I can say that's how I feel from my perspective, or maybe that's how I'm
Absolutely.
hoping. But I do feel like it's just more, just like light is becoming more popular. This was never accepted even 15 years ago. It wasn't a thing. You're crazy. So the fact that it's even a thing now, it's an industry. Like you can, I'm sure anybody who's listening to this podcast can check their phone on Google and a ton of devices are going to pop up. I'm just grateful to be riding this wave and in it and have this experience because I can't wait to see what it becomes in the future. One of the most inspiring books for me was by Jacob Lieberman. It's called Light Medicine of the Future. And one
Mm,
of my neighbors, when I was injured and had bought my first device and was in the process of healing, he gave it to me. And he was like, I think this would resonate with you. And he had like a little kind of like a wellness business. It was very ahead of his time. This is like early 2000 in his condo with like all lights and sky, like you had all windows. And he had like a dark room for meditation and like a yoga room and a water room. And then I was going to be the light room. And I ended up getting better and moving away and starting business and doing all this. But like that guy gave me this book and that really saying light medicine in the future, that cemented in my mind. I was like, I'm not the only one. I'm not crazy. There's this doctor that's saying it. And a lot of it was about eye health. He did a lot
absolutely.
of floaters and things like that, which we help with too. But that's what it was about. And so I recommended that book because it's like, this is the medicine of the future, but guess what? The future is here right now.
So we have the technology,
We
we
have
have
the
the
technology.
devices.
In Taiwan, we're in every department. So it started at one, which we do a lot of our research with, and then in one department, and then it spread. And it's been driven by the patients, not by the hospital or the doctors themselves. It's driven by the patients requesting this. I know somebody, they got this. Okay, I'm going to go to that hospital. No, come to ours. And so it's really patient driven, which shows you it's like you don't have patients lining up out of the door to receive medication unless it's highly addictive medication. But like, for something like that, it's just I think we can get there here. Just got to get through a little bit of red tape and acceptance and like, you know, daring daring doctors and daring practitioners to really make the leap. Make the leap, but make it in faith. And that's what it takes because patients here in the US are going to listen to the doctors and as they should, and check in with your doctor. See, and I always recommend to my clients, don't keep this a secret. If you're seeking out or help outside of your doctor, let your doctor know that you're doing this. You might spark an interest in them and they might co-sign on what you're doing and pay attention to what you're doing and maybe help other patients. And that's how it spreads. So be daring, whether you're the patient, the client, or the doctor, and take a leap of faith in something natural that you know to be scientifically proven effective. Because I always tell people, you can talk about coming in and you can lead a horse to water, you can't make him drink. I say you can lead a human to light, but you can't make him then do it. When my clients share with their friends and their family, and they're like, I've told Mary 10 times to come in. She hasn't come in. I'm like, hey, just when Mary's ready, she'll be ready, And then I tell him, you can lead a human to light. I would drive myself crazy with all the walls I've ran into in the nose, but I just have to like let it flow. Let it
Yeah.
flow like water because someone will pay attention and that's all you need. We have more and more we have doctors, we have dentists, pain management, internal medicine, neurology, dermatology. Those are like the scope of chiropractic. So that's a pretty wide scope so far and we're just getting bigger. And so I want to keep spearheading this movement.
Amazing. Thank you so much for sharing all of your knowledge with us. Tell us how people can find you, how can people come into your clinic? Tell us more how we can work with you.
Wonderful. Yes. So my clinic is ultra red light therapy. It's in Newport Beach. It's really convenient off the 73 and 55 freeways. I have multiple rooms in here. We even have a family room. You can find me on my website is ultraredlight.com. Also socials, Facebook, Instagram, ultra red light. And I have light dash academy for training courses. And
Perfect.
then
And I will link all of this so that it's in the show notes.
thank you so much for having me. I love chatting with you.
Oh,
And
is there anything we haven't covered that you want to throw in right at the end?
I would say, lastly, that, just if anybody thinks that you're crazy for trying light, like a family member, friend, or anything, just let them know light isn't woo woo. This is real science. It's a primary nutrient that we need as living beings. And it's just like water, it's just like oxygen. Nobody doubts your need for water or your need for oxygen. So why there's this stigma about light and how it's, maybe woo woo, I don't know. So just stick with what you know, your gut, and get back down to the basics because the basics are really how we evolved and we can heal ourselves.
Thank you so much, Brooke.
Yes.
You've been listening to Authentically Shauna with Dr. Shauna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referenced in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. Thanks, and we'll see you next week.